After trying multiple times to pass some form of legislation that would repeal and replace the Affordable Care Act, President Donald Trump recently announced that since he's unable to get it done through Congress, he would be unilaterally dismantling the Affordable Care Act via executive order.
In a few moments, I will sign an executive order taking the first steps to providing millions of Americans with Obamacare relief. It directs the Department of Health and Human Services, the Treasury, and the Department of Labor to take action to increase competition, increase choice, and increase access to lower-priced, high-quality health care options. And they will have so many options. This will cost the United States government virtually nothing, and people will have great, great health care. And when I say people, I mean by the millions and millions.
Now, what he's telling you about this executive order might sound nice at face value, but really what's happening here is he's allowing insurance companies to rip you off even more than they've already been ripping you off. So according to Jonathan Cohn of the Huffington Post, he explains that the order will primarily affect small businesses and people who buy private coverage on their own, rather than through employers. It could lead the kind of transformation that, according to experts, GOP repeal bills would unleash if one of them were to become law. In particular, the new, less regulated insurance plans could provide an attractive alternative to consumers who don't expect to have large medical bills and who are frustrated with the high premiums they pay for policies today. At the same time, comprehensive coverage could become harder and eventually even impossible to find, especially for people with pre-existing conditions. But some parts of the order are likely to take effect more quickly. Perhaps the most consequential of those is a decision to end a rule that limited short-term insurance plans to no more than 3 months. The 3-month limit came from the Obama administration, which worried the short-term plans would draw away consumers in relatively good health, causing state insurance markets to split in two. Taken together, the actions that Trump's Thursday order envisions could have precisely that result. And basically, what would have happened if Trump was able to pass some form of repeal and replace bill through Congress, it might just come to fruition with this executive order, because what this order does is it begins chipping away at the Affordable Care Act, and that will have a snowball effect. Because healthcare, it's a very volatile industry. If you change one little thing, that could send shockwaves through the aggregate industry. And really what this order does is it opens the door to cheaper, less comprehensive healthcare plans that might seem like a really great deal to someone at first, but you'll find out just how much you're being taken advantage of when you actually get sick, because obviously these cheaper plans aren't going to cover much of anything. Now, his executive order also cuts off funding for advertising and outreach, making the already taxing process of finding healthcare even more difficult by reducing information available about it. So, as someone who criticized President Obama for using executive orders too much, I mean, for something like healthcare that affects 1/6 of the overall U.S. economy, to use an executive order here, it goes against everything he said when Obama was president. But he doesn't care. It doesn't matter if this makes him look like a hypocrite. This is Donald Trump we're talking about here. He's contradicted himself 1,000,001 times, and this really is no different here. And he has an agenda. Repeal the Affordable Care Act so that way he can check off the box and say he did one thing that he promised he would do. Because certainly getting the wall built on the southern border, it's proving to be a lot more difficult practically and logistically than he probably thought when he was running to be president. So if he could at least do this, then he could say, look, I came through on this promise. And I love the wording that he uses. He says that he's offering Obamacare relief. Well, what was Obamacare? Obamacare was an improvement to our healthcare system. Yes, Obamacare wasn't the end-all be-all, but it was an improvement. It did expand access, and yes, part of Obamacare was subsidizing health insurance plans. But the reason why Obamacare is failing is because, one, we don't have any cost controls in this country, and second of all, we don't have a public option. If Donald Trump really was concerned about providing the American people with affordable health care, then he would encourage Republicans and Democrats to come up with a public option, because that will keep the costs down, because it influences these private companies to compete with the government-run plan. And when a lot of people ultimately end up gravitating towards that public option, then that forces these private companies to actually become cheaper and stop ripping us off and offer coverage that's actually comprehensive and covers more. But with these plans here, people might think, oh, Trump is doing a great job because look, the cost of healthcare, it's coming down. But again, if access to healthcare is all you care about, then sure, this might be a great step for you. But if you really care about taking care of sick people, this will not do that. This is antithetical to that goal. Because just saying that you have healthcare, that means nothing if you actually get sick. Do you honestly think these cheaper plans will cover a really expensive surgery if you need it? Do you honestly think that you still won't risk going bankrupt if you have a medical emergency with these shitty, cheaper, skinny plans? Donald Trump is selling you a lemon. And what he's doing here, it's harmful. We might not see all the consequences right away, but certainly, this is the beginning of the end of the Affordable Care Act. And this should be all the more reason to galvanize Democrats to fight harder than ever for Medicare for all, because that is the only way we're going to end this healthcare debate once and for all.
Support this podcast by becoming a patron at patreon.com/Humanist Report.